Good morning, everybody. Dr. John Willardson here, and with Memo Gea, and we're here in beautiful Newport Beach, California, where it's pouring rain. We've got a lot of rain here, which is great. I enjoy the rain. I don't mind it too much, except people somehow forget how to drive when it rains in Southern California. I can't imagine if it snowed, it would be complete mayhem. So, Memo, how was your week?
Week was good. We've been somewhat busy with a bunch of stuff that we're doing here in the office. Everything else that we are implementing and adding, as you know. But other than that, great. As long as, we're healthy, family's good, that means that we're blessed.
Absolutely.
So, how about yours?
Yeah, week was good. As I mentioned last week, my youngest son, Seth, came home from his mission. It's been great to be with him and spend time with the family. Kind of reflect on the things that matter most, as you said. It's been a good week. Prior to today, it was beautiful. It was sunny, and the beaches and the weather was great. But it's raining now, which is good, which we always need the rain. And I love it when the hills turn green and there's snow on the mountains. Southern California is a beautiful place when we have that, Yeah. So. What are the updates with TIP, Trust Implant Partners, which is a new venture which we are in doing here at Trust Implants?
Yeah. So like we mentioned, I think it was like 2, maybe 3 live streams ago when Dane was here. Everything's up, ready to go. We're having those conversations with new doctors. For those of you who weren't here 2 or 3 live streams ago, Trust Implant Partners is just Trust Implants kind of expanding and being able to provide the same techniques and procedures all over the country, hopefully the world. But the idea is to avoid or to help patients avoid the all-on-4 centers. But it's just how we've talked about the whole system is broken, right? We have, 2 days ago we talked to a doctor that was telling us that the owner of Clear Choice is now partnering with a bunch of little practices, right? To, what was it, like overdentures or
for dentures? Yeah, for overdentures, which is the reason why I posed the question, because on our, I just want to show some videos of. I don't watch TikTok, but. These were sent to me, and as I kind of did a deeper dive into obviously you can find whatever you want on TikTok, but even as specific as dental implant surgery, oral surgery, dental implants, there are thousands and thousands of videos. So a couple that I came across, and hopefully my technology skills are good enough to present these, but I want to show this video here. This is, and again, it goes back to the reason for Trust Implant Partners is to elevate the quality and elevate the results, elevate the industry as a whole, so that situations like this can be minimized, or at least as patients go in to have these procedures done, and terms like alveoloplasty, osteotomy, osseointegration, these big terms that the dentist likes to throw around, which to the patient doesn't mean a whole lot, but these patients that are now learning these terms. For example, we'll watch this video, and this young lady was quoted a fee for, I believe it was an all-on-4, but however she said 3 implants. So there's a lot of disconnect between what is planned, and that's why I say, and Memo says the system is broken. There's no structure, there's no continuity, there's no standardized care, no standardization in the industry. It's very the wild, wild west, people are using mini implants and overdentures, and it's just kind of all over the place. So, and we don't do any of that here. And I'm not promoting myself or Trust Implants, but I truly am on a mission to standardize the care for patients, because until the case is completed, the patient has no idea what they're getting. So we'll watch this video real quick, and then we'll talk about a little bit. I'll kind of stop in between. We'll talk about some of the aspects of the video. So hopefully it'll play, and hopefully you'll be able to hear it. That's the key. Okay, so you can hear? Okay.
This is, honestly, it's better, but I'm looking at $6,870 to get an alveoplasty. 3
Okay, so she was quoted,
least.
for an alveoloplasty. What is an alveoloplasty? An alveoloplasty was a reduce the bone. I've talked about this in my other live streams. She was also told that she has severe bone loss, and if she does not do this procedure, she is going to lose all her bone. And this makes zero sense, because an alveoloplasty is reduction of bone. So they're cutting the bone away on a patient who they've diagnosed or said that, if you don't do this, you're going to lose all your bone. But then and some doctors they'll cut 10 millimeters of bone down, and they do that to create space for the prosthesis, especially when they're using plastic or a titanium framework with plastic teeth and plastic material. They need that thickness in order to create a level of strength in the prosthesis so it doesn't break. So here she's being told that if you don't do this procedure, you're going to lose all your bone. And then when they go to do the procedure, they cut away a lot of the bone. So it just does not make a whole lot of sense. So,
well, I mean, she's making a video about it, right? Where she's like,
right, yeah. I mean, she's making a video about it, and you can see how much, and they've instilled this level of fear in her. And I've not seen any X-rays. This is just off TikTok, so I have no idea the background of the case, and but you can see how much it's affecting her and how much she is kind of distraught over the thought of, 1, losing her teeth, 2, losing bone, but then 3, discussing an alveoloplasty, which is where the doctor is literally removing a lot of bone. In my practice, if I ever have to do an alveoloplasty, it's only to smooth and contour the ridge. I'm not removing bone to create room for the prosthesis, to create more strength in the final prosthesis. Why is that? Because I use zirconia. Zirconia is very strong. I can make a prosthesis that's very thin, that feels more like your own natural teeth. It is unfortunate, and I'm sure that her teeth had to be removed, and it's unfortunate in those cases where patients lose their teeth, but our goal is to give them the prosthesis or the replacement teeth that feels as close to their own natural teeth as possible, right? And to reduce, and I speak in millimeters, but 10 millimeters is probably ½ an inch of reduction. That's a lot of bone. I mean, when I do an alveoloplasty, which is literally just smoothing and contouring the ridge, I'm just taking the sharp points off and making it so there's no uneven edges. But there are cases where, let me see if I can, there are cases where we have to, like, for example, here's a picture of a patient. So these teeth have to be removed. And I do need to do an alveoloplasty because I need to level this ridge off and get down to a level of bone, but that is sufficient so I have implants all at the same level, because that's the other thing. If I were to place an implant here and then this one over here is the height of contour, the height of the implant is off, the body doesn't like that, and so it will try to compensate, and that bone will start to pull down. So the other rationale for an alveoloplasty or ridge reduction is to smooth the ridge so that you have even contour, so the implants are all at relatively the same level. So there's reasons for these things. In fact, she's talking about the price of the alveoloplasty. I mean, when I get into a case like this, I'm not even charging for that. That's just part of the procedure, you know. But everybody has their own way of doing things. So, all right, we'll look at a couple of more of these crazy TikTok videos in just a second. But one thing I would like to show is so in implant surgery, when we're placing implants, we are, and I've talked about this in different live streams. So here is a ridge, and sorry for the graphic images, but it is what it is, and it's actually a beautiful image because this is the body healing, the blood, the bone, the BMPs, the proteins that are allowing these procedures, grafts, implants to integrate and to heal is actually a beautiful thing for me. And so here I have different techniques in implant surgery when I'm placing implants. So I'll either drill this bone out, but because this is grafted bone, I want to more condense it. I don't want to remove a lot of it. I want to try to condense the bone. And this tool that I have in my hand here, or in this video, is an osteotome. And that is a tool that I use to expand the ridge so that I can minimize the removal and reduction of bone and more expand and kind of manipulate the bone. It's really pretty cool how I can split the ridge, I can crack the bone, and take a ridge, for example, that's like 3.5 millimeters in width, a very minimal amount. I can fracture that bone and put in like a 4.5 millimeter implant. But it's all very controlled, and that's the only reason why I bring it up is because it's a very controlled procedure. I've already started the initial osteotomy or hole for this procedure, so I went in with like a 2 millimeter pilot drill, but I stopped at 2 millimeters, and then I start putting in the osteotome, which ended up being at 3.5 millimeters. And now I'm placing a 4.5 millimeter implant. So at each step, the hole that I create is smaller than the next thing that I want to put in there, right? So as I drive this implant into the osteotomy, you'll notice I'm getting very high torque values on the torque, on the torque wrench, and I'm not afraid to get 70 newton centimeters of torque on these implants. I know the rigidity of the bone, I know the elasticity of the bone, I know the strength of the implant, so I'm not afraid to do that. There is one thing I have to consider when placing implants and getting that much torque in the hole itself, and that is like necrosis of the bone. So when I put too much compression on the bone, you can get the bone to die back. So if I put too much torque on it, so what I'll do at that point, if I'm getting too much torque, I'll back it out. I may go back in and expand the hole a little bit and then put the implant back in. But I've done this so many times, it's kind of like clockwork now. But there are aspects of getting too much torque on the implants. You can fracture an implant as well if you put too much torque on it. But given the right technique, given experience, you won't end up with those sort of problems. So, and let's see. And then here's a video of just placing implants just by drilling. So here, and you can see where we've got extracted sites, so the teeth have come out. I've done minimal reduction, almost none. So I'm placing these implants basically exactly where each tooth falls. And so as I drill each hole, those tooth sites give me basically the position of each tooth. So it's like, it's basically a surgical guide. And so I'm able to really plan out and place these implants exactly where I want them, because that's where those teeth were. And it's going to give the patient the most aesthetic, functional, natural feeling end result by doing this. And so, but in an all-on-4 center, they would reduce this bone, they would cut away all of that beautiful alveolus, which is the holes that the teeth comes out of. That would all be gone. They would cut it down to 7 or 10 millimeters. They would be only placing 4 implants. And so there's, the rationale behind these things it's very important. And with the Trust Implant Partners, this is what we're trying to standardize and make it so, and sorry for the glove that's in there, but we want to standardize these protocols so that patients don't end up with something, because once this case is done and complete, that's it. There's no going back. There's no removing these implants. There's no redesigning the prosthesis. It is done. Once the implants are in place, the doctor or whoever's doing the case is stuck with having to utilize the implants in those positions. So again, torquing the implant into place, getting high torque values, and using the osteotome, a little bit of drilling and osteotome. And so, sorry, this video is a bit long, but it really kind of drives home the point of proper planning, knowing the patient. So I learn a lot about this patient at their pre-op appointment or when I meet them, right? And I'm already starting to think about, okay, what is going to be the most ideal long-term result for this patient given their situation, given their history. I mean, a lot of times they've been to the dentist so many times. They've had crowns, they've had root canals, they've had bridges, they've had partials, they've had dentures. They've just tried to do everything that they could in order to have some sort of normalcy in their mouth, right?
Yeah.
And this is kind of the last step. And it is the last step when done properly, when executed on correctly. It truly is the end result, is amazing, and it is a transformative procedure. But when they end up with for example, an all-on, and not just all-on-4, when they end up with mini dental implants and dentures, here's a case where the patient, again, had an all-on-4 procedure.
It's this.
And now she's concerned, well, not concerned, but you can see
teeth
this
themselves,
massive
they're a great size.
piece of plastic in her mouth.
I have nowhere for my tongue to go.
Which cannot feel normal. And you can see the contours of that are just so off. And again, it's a matter of not proper planning, not really knowing how to execute on the end result of the final set of teeth or prosthesis. And that's what she's left with. She's stuck with that. And that's what we're trying to avoid,
Yeah, and in a way, I feel like all these influencers making these videos is helping us out.
It is. Because I didn't know this existed. You know?
I mean, I feel like we can go through TikTok and we could every live stream show different videos of this. And because this, I'm glad they're creating the awareness, because this is what we're trying to fix. Like we've talked about multiple times, these all-on-4 centers, and we were just going to call them all-on-4 centers. We don't want to say the name of the companies, right? Or I don't know if we could, but as we know, these are big corporations, like franchises, just like McDonald's, just like, any big corporation.
Right.
And the employees of these companies, especially like the doctors, they're not invested in this. They're just collecting their check. I was on the phone with Chase yesterday and with one of the customer service representative, and they don't care. Their goal is just to be there to collect their check, and their goal is to spend the least amount of time on the phone with me just so they can get the next call. Yeah. And that is the whole goal of Trust Implant Partners, is the practices that we're going to partner with in whatever city is, they're owned by a doctor. They've invested, They've probably owned this practice and put their heart, sweat, tears, everything into their practice. And they're only going to partner with us, so they're still full owners. So they are going to be invested in the procedures. They're going to be invested in the patient.
Right.
Because most dentists want their patient to be with them for the rest of their lives, right? Like you want them to come back to do cleanings and see how they're doing. A lot of the times people build a good relationship with their dentist. And if you go back to your dentist and it's just completely different one, and then 6 months later it's a different one, and another one, they're really not going to know what your situation is. At all,
yeah. I don't know if you can pull that video up, Memo, of the lady with the dentures and the long fingernails on TikTok.
We do have a comment. Let me pull it up if you want to just go over the comment.
Okay, let's see. What do we got here? Great doctors love education on this subject. Was flooded with all of this all on fours, all that comes up on Google. I think that dentistry is stuck in a time warp. It's very, very true. This is Kalpana Shah. All other areas of medicine have evolved and moved on, but dentistry is as a shame, as a patient, has been denied and takes away body tissue to accommodate and replace with plastic. So sad. Very, very, very true. To replace the tissue with plastic is sad, and that's what an alveoloplasty does. It removes good, viable tissue and replaces it with plastic. No doubt about it.
Was it this video that you're talking about?
She has like the long fingernail, that one right there. I'll show this video while Memo sends that one over to me. But here's a patient who had recently had surgery. And, you know, you look at this and you think, oh my gosh, this is horrible. But I look at this and I think she's got good blood flow. The sites in the mouth are probably healing very well. It's a little traumatic. Who knows what exactly she had done? Most likely bilateral sinus augmentation. The one thing that I would note is the bruising on her chin. Most likely was traumatized the mental nerve. Hopefully not to the point of paresthesia, because that was. What can happen is if you traumatize either the infraalveolar nerve or the mental nerve, if you cut it or if you traumatize it, damage it, you will have paresthesia or numbness in your lip. Can be permanent. It is a risk of the procedure. It's, you know, if you're working over these nerves or around these nerves or manipulating any nerves, but especially substantial nerves like the inferior alveolar nerve, and even the mental nerve, you can develop paresthesia here. But so postoperative healing, postoperative bruising, this, I wouldn't say it's common. I would only see this in my practice if I was doing major bone grafting, for example, doing a major ridge augmentation, bilateral sinus graft, and, you know, most likely they did a lot of bone reduction on this patient. That's, I would imagine, is the case here. But again, hard to say, but it is certainly, you know, part of the healing process. And so it's
looks like she went full 12 rounds with someone,
yeah,
and still
looks like
lost.
she's been boxing with Memo.
I'm about to share this with you,
okay,
doctor,
yeah.
so that's the one video.
Let's see, accept that real quick. Now this is an interesting one because
Hi, and yes, to answer your question, I am Alicia, the girl with the snap-in dentures. I have mini implants.
Can they hear this?
They look like this, and on the top, you want to see them?
Okay. Let me just go full screen on this. And so this lady apparently is an influencer for her. I'm going to back this up a bit.
You got to move it a little bit more to the right.
Hi, and yes, to answer your question, I am Alicia, the girl with the snap-in dentures. I have mini implants. They look like this, and on the top,
hopefully you can hear the audio. But what I want to do is just kind of. So here's
I am
a lady
Alicia,
that.
The girl with the snap-in dentures. I
First of all,
have
she's
mini
young.
implants.
She's very young. All right, and let's stop right there. So she's got, and she's promoting. Removable dentures on implants or mini implants, and she talks about how it's the most wonderful thing. She loves it. She goes in next and same day gets her teeth locked down onto her implants, which is great. But if you only eat at McDonald's and you've never been to Fleming's, then you only know what the food at McDonald's tastes like. So my point is that this would be for somebody.
On the top, you want to see them?
I don't know. For the normal person, this would be an awful thing to have to deal with on a daily basis. Taking your teeth in and out
quickly. Okay, so I have 6 on top, 4 on the bottom.
Titanium, mini little tiny implants.
Yes, it was done in one
poking
day.
through your gums.
That's part of the appeal. So I went in there with
It would
13
just
natural
be,
teeth. They pulled them
it would not be a very
all, gave me
pleasant
10 mini
way to
implants, 6
live.
on top, 4 on the bottom.
But this is kind of
Immediate,
what's
same day
going
snap
on
and
out there
denture.
in the industry. This is very typical. You have like this company that's called Shatkin, I believe. They only make and do mini implants. And so they've built their entire business around mini dental implants. There's other companies like Dentures Affordable or something like that, or some denture practices that have built their entire practice around mini dental implants. And it's almost like a pin that has a little head on top of it, and then there's an O-ring inside the denture that snaps onto that head and kind of holds things in place. They put as many implants in as they can because they know that they're either going to break off or eventually or fail. So it's just a whole different type of treatment that would be really tough to live with on a daily basis. Versus doing, let me see if I can pull up, let's see here, live stream. Okay. Versus having cases where if we look at, here is a full arch upper all on 6, or all on 8, actually lower all on 6. Again, the patient had to have her teeth removed. There's no disputing that. There's no debate there. And this is plastic. This is not the final prosthesis. These are temporaries. But I've reduced minimal amount of tissue, tried to keep the bridge or the prosthetic as small as possible, tried to mimic nature, biomimetics, tried to mimic nature or her teeth as much as we possibly can so that it feels natural, so that she isn't having to pop her dentures out of her mouth and have these tiny little mini dental implants sticking through her gum tissue. And so, another case here, again, all on 8, upper jaw implant positioning is very methodical and planned out. Again, the patient had to have her teeth removed. There was no other option. I don't know if, you can see this, but very clean tissue around each implant. Nice, long, wide diameter implants are not the tiny little mini implants that we saw in that other video. And in reality, no one would really want to have this, but this is the best solution, the best option for this patient, given the fact that she had to have her teeth removed. And so here is just some photos of before. But look at the after. Of course, she looks great, and it feels natural. Her tongue has sufficient space to move around. The teeth are not moving around. They're solid, they're strong, and it is the best solution for patients that have this situation. And this was just last Monday, actually.
And Doctor, talking about all this stuff, this last week I just kind of been talking to certain patients that are Spanish speakers, right? So I can communicate with them better. And I'm happy to see that patients know and understand this when we present these options.
They're starting to, right?
Yeah, and they actually do the research and they find out, and it makes sense to them. And I just say that because I was talking to a consultation that you saw in our other office.
I'll show her X-ray, yeah.
And just to like a little bit of a background, she went and talked to another all-on-4 implant center, and they just quoted her a certain fee that was a bit lower than the fee that we have here, but they only offer the all-on-4. Now, I want you to talk about we'll show the X-rays, and then what you see in the procedures that you offer her, and then we can dive a little bit more into it, because I've had a couple of conversations, actually more than that, with her.
I know you have, yeah. So here is her X-ray. Let me close out of some of these things here. All right, so this is the X-ray of the patient that Memo is talking about, and I hate to keep just showing X-rays, but it's the way that I speak, and it's the way that we kind of represent what's happening for these patients. But so if you'll notice on the X-ray, all right, so this tooth here, for example, And you see how dark this area is, just to orient ourselves around the x-ray. Well, first, this is the upper jaw here. This is the lower jaw. And what you would want to see is the bone up to kind of the area of where the enamel and the dentin meet, the CEJ, that the bone is up to that level. As somebody develops periodontal disease or the bone starts to pull away, eventually it gets to the point where the bone is at the tip of the root, which is where she's at right now. So this tooth is only being held in place by soft tissue. There's no bone supporting it here. Same thing here. So the bone now is clear down, and my cursor's small, but it's way down at the apex or the tip of the root. And then same thing on the top. All this bone is pulled away from the root to the point of where it's at the tip of the root. And so, you know, if she walks into the corporate all-on-4 center and sits down and they look at the x-ray and they say, oh yeah, let's go for it, let's do an all-on-4. Well, first of all, the doctor will have his hands full when he gets in there, because once the teeth come out, he'll realize I have no bone to work with here. I have to regenerate this bone. I have to graft the sinus. I have to, you know, I've got to treat this case very differently than the cookie cutter all-on-4 procedure that I've done, so not me, but as the doctor's done so many thousands of times. Now I have to deviate from that procedure because this case will not afford doing the all-on-4. It literally will fail. There's not enough bone, there's not enough support. And so whether the patient pays, you know, like you said, they were paying a lower fee, I think it was somewhere like around $40,000 or $45,000, and no matter what they pay, if they pay $30,000 or $40,000 or $50,000 or $100,000, if they do an all-on-4 on this case, it's going to fail because there is just not sufficient bone to support it. And so, you know, to put everybody in that box and to try to squeeze every patient into the all-on-4 box is not fair to the patient. And that's why, again, why we are developing Trust Implant Partners. That's why we're on this mission to help change the industry somewhat. I mean, we're not going to be able to change it, you know, too much, but at least in our world and in our practice, we will be able to make it so that the standardized care is more than just the all-on-4. Because in this case, the all-on-4 definitely would be a failure.
Yeah, and I mean, the way that viewers can help is by liking our video and sharing it with people so that we can create that awareness. Because really, one of the things that I do in the few times that I talk to patients, I just say, go on our YouTube channel and just like, you can learn it yourself. A lot of the times they watch the videos and they're right back here because it makes sense. Like, we try to be transparent. We try to be honest with everything. Going back to this patient or that we were talking about, when I was on the phone with her, she's like, I know that what you guys are telling me makes sense. I know that it's true. I know that there's no other place that I need to get this done. But with you guys, the finances is kind of what's holding her back, which is what we work with patients. But another thing that she had mentioned to you guys was that she smokes, 7 to 8 cigarettes a day, right? Mm-hmm. And that's the one thing that I talked to her about. I said, hey, listen, Dr. Willardson wants to see you one more time so we could, because we want to see if this is something that we really like want to go through. Right. And she was like, well, I love that. You guys aren't just saying, here, like, we'll do it for you without like even planning or anything. And another thing that I told her, I said, since you smoke, you need to make sure that you stop smoking. And something that you told me was that patients need to stop smoking 2 months before surgery and like 3 months after surgery.
Yeah, there is a smoking cessation protocol that patients that just simply will not stop smoking, they have to, in my practice, they have to sign a waiver stating that they understand the risks, right? Because you have about a 20 to 30% higher chance of failure of the implant itself. So, and again, going back to why, because you are suffocating the healing in the mouth by the by the carbon monoxide. And so you're suffocating that blood flow. You're suffocating the healing factors that are so critical to the healing process. And it's directly affecting the surgical site. So, I've said a million times, if you have a knee replacement, surgeon is going to be adamant about no smoking. And that's an indirect effect. The smoke isn't going directly to the knee. When you have dental implants and bone grafts and sinus grafts, it's literally going directly to the surgical site, so it's affecting the healing process. So smoking is a big factor to consider. And like on this case, I don't want to take one penny from her, especially if it's, if she's kind of stuck on a certain figure or number, which I've, on some of those TikTok videos, they're talking about, oh, dentists are thieves, dentists are crooks, they're just out to make money. But that's just so not the case. I mean, again, I wouldn't want to take a penny from her if this case didn't work, right? Or offer her something that is questionable as to like an all-on-4 in her case, given knowing now the fact that she has no bone, and then the whole thing failing, I don't want to do that either. So you have to charge enough to justify the amount of work that is necessary in order to have a successful case. If the patients are simply out for getting the best price, then I am definitely not the right guy. I give a fair price, I give a good price, and the price can vary on one patient to the other or next, because I consider okay, I got to do this sort of grafting. I got to graft the sinuses. I need to place more implants in this situation. I want, as I get to know the patient, I think about the design of the final set of teeth. So all of these factors I have to take into consideration. So, price, we always are very conscious of and give the best price we possibly can. But more importantly, I want to give the best results.
Right. Yeah, and then just kind of like what you mentioned, I put myself in the shoes of patients, and from everything that we hear, from the videos that we watch on TikTok and on YouTube, I get why they're saying that, dentists are crooks, they're trying to take your money, because some are, right? Like for this patient, when I was talking to her about the smoking, she was like, oh my gosh, I asked the dentist or the oral surgeon if I should stop smoking. And he was like, maybe after the surgery, after we get everything done, right? And she was like, what you're telling me makes so much sense. She's like, the reason why my teeth are gone is because I smoke a lot. And they're telling me that I don't need to stop smoking, but you're explaining to me why you need to, and the healing process and everything. She's like, I'm not going to trust anyone but you guys. And so, again, putting myself in their shoes, I get it. I understand. And you see that these dentists are just trying to do it to get you in and out. And that's why they're promoting, hey,
all on four,
but not only that, teeth in 24 hours. They're like, yeah, we'll get you in and out in 24 hours. I'm like, yes, I understand patients and why they feel the way that they feel. And again,
I get that. It's kind of like a few live streams ago, that patient who had 19 broken sets of teeth. That's a case where, and I could pull it up, but a case where, the doctor promised something, got in over his head, and now is just totally out of control. The case is out of control. And that's where it's important as the doctor to understand the patient, understand the procedure, understand the dynamics of their situation, like this patient here that is actively smoking, has a lot of bone loss, and needs some additional grafting and procedures in order to have a successful outcome. And stopping smoking is a big part of that successful outcome. And back to that smoking cessation protocol, it's an old protocol from 25 years ago, but stop smoking for 2 months before surgery, 2 to 3 months after surgery, and then most likely all of the healing is done, so the patient technically could start smoking again. Hopefully, if they've stopped smoking for 5 months, they'll stop for good, because there's so many other benefits to not smoking.
Yeah, and that's what I was telling her. And any person out there who's missing teeth and are smokers, get dental implants. Maybe that's going to get you to stop because you're going to have some money invested. And that's, when you get the urges to smoke, you're going to be like, sheesh,
I don't want to waste my implants.
Your implants. And
Plus, how much money would you save on not smoking? I don't know how much
the
cigarettes
payments
cost, but they got to be pretty expensive if you're smoking a pack a day or 2 packs a day,
Yeah. Well, mainly I would say for me is like the bag that you drop, right? Like the investment. I'd be like, sheesh, I just dropped, an X amount of dollars on this. I sure better stop smoking because, I'll be right back to the oral surgeon in, I don't know, 2 years maybe? You think that would how long?
Yeah, I've done lots of cases on patients that have smoked. Some patients didn't stop smoking for 1 day, and cases are still fine. So I think genetics play a role in that as well, and just their health. If they're diabetics and they're smokers and they're got a bunch of other health issues and concerns, the chances of failure go up on each one of those things. So,
well, that's what we talk about here, because we say all on 4 works, but the chances of a failure for it are higher, right? And so our motto or what we're teaching is do everything you can to lower your chances of failure, right? Get the right procedure, stop smoking, do all those things.
Number of implants.
Yeah, because if you can go from 60% chance of failure all the way down to like 10%, who wouldn't want that?
Yeah,
right. So
especially whether you've spent $30,000 or $60,000, right? I mean, you want to protect that investment. You can't afford to just throw that away and throw that money away. Plus, if you do have a major failure where you have 3 of 4 implants fail, now your bone is completely destroyed, and you're going to have to do a $30,000 or $40,000 bone graft to regenerate that ridge in order to have implants in the future, or you're just going to have to live with the denture. And I can say that anybody who's had implants and then not had implants, because I've had cases where the patients have had implants in other facilities, case fails, they end up in my practice, and then we have to remove those implants, and I put them back in a denture, so they went from teeth to implants and then to a denture. They want their implants back. They're like, I don't care what it takes, I want implants back, because they now know what it's like to not have to deal with the denture on a routine daily basis. So, which is part of like that TikTok video of the lady with the snap-in dentures. She doesn't know what she doesn't know. If I gave her a fixed prosthesis on 6 implants, she would think that those dentures are just a joke, So, but she doesn't know that, and she thinks they're the greatest thing.
Yeah. I have one more comment here, or we have a couple. We got the comments popping right now. Will drinking alcohol have a negative effect on implants?
Actually, it kind of cleans the area, but it's a negative effect on your liver, and it's kind of affects the healing process. So does not have as great of negative effect on implants as smoking does, but just anything that is not healthy, whether it's for your implants or your body in general, will have a negative effect on your implants. Poor hygiene, if you're not irrigating, brushing, flossing, if you're just not brushing your teeth, if you're drinking too much, if you're smoking, all of those things are going to affect the health of your implants long term.
Okay, and then we'll do one more because we're almost running out of time.
Yeah.
Does the brand of implant really matter?
Does the brand of implant really matter? The brand, not so much, but the material matters a lot. And some brands don't use the best materials, so yes, it does. Now, if there's a brand that's using a good quality, commercially pure grade 4 titanium, and they're an off brand or a brand from China or a brand from Korea, then that implant will be fine because it's the material, not so much the brand. But usually when you get an implant from China or somewhere, it's definitely not commercially pure grade 4 titanium. It's a hybrid or an alloy of some sort. And when you mix metals, like I've said in other live streams, you don't know, and I could talk about this all day long, but there's some of these knockoff brand companies, won't mention any names, but they have their rod of titanium, and one lot of implants will be from one rod and might have slightly different, if it's an alloy, in that alloy, there could be slightly different levels of, palladium, for example, or nickel, whereas when you have commercially pure grade 4 titanium, you are only getting titanium. You're not getting any mixture of any other trace metals. And so that's why I prefer using commercially pure titanium. Commercially pure grade 1 is too soft. It'll break. So that's grade 4 is harder. And so it's what's in the implant that matters.
Okay, yeah. And just going along with that, I want to say last summer, we made a whole entire video because there was a news report, remember, about like thousands of implant failures. And the main reason why these failures were happening is because of the alloy, titanium alloy, how it had nickel and all that. So if you're interested in watching that whole entire video, I know it's a live stream right now, but once we get the video uploaded, we'll link it below, because it's something that patients should definitely know, especially like if you don't even know if you're allergic to nickel or things like that. Yeah. And it doesn't matter who the doctor is, if they still place that implant, there's going to have an allergy.
Yeah. I mean, some patients can be allergic to titanium, but very, very, very few. I've never seen a patient with a titanium allergy, but nickel allergies are prevalent, and the reason they would add nickel in a implant is to give it strength. Excuse me. And so that's the implant itself. But then if you have on the bridge or the prosthesis, if there's nickel in the metal that's touching the implant, that too can create an allergic reaction. That news piece that was put out about all of the failing, it was the warnings of dental implants, is more a scare tactic. And when I looked at and I critiqued the video, because I want to know, okay, so they're critiquing us as surgeons placing implants. What are we actually looking at here? And the quality of the placement of her implants, the quality of her implants. I mean, all of it was not good. So she did have a point, but again, it's why Trust Implant Partners is so important, because we are trying to eliminate a lot of these things that are creating scenarios where patients are being harmed, right?
Yeah.
Our goal is to do no harm. We don't want to harm anybody. If I put a titanium alloy implant that has a high nickel content into a patient's mouth and all of a sudden they develop an allergic reaction, or the implant starts to fail, or if I do an all-on-4 case and then in a year on a patient that is not really a candidate, like the x-ray here, that they need more grafting, they need more methodical planning. It can't be done in a day. It's got to be, the grafts have to heal, the implants have to heal, all of these factors need to be considered so that we do no harm. That is our goal, just to not harm anybody financially, medically, in any way, And so that's our goal. So.
Yeah. Well, these videos, whether we like it or not, they're great marketing for us, because it's creating that awareness, right? And again, hopefully, I feel like these live streams do help. I mean, we get a lot of feedback from new consults saying that they've watched the live streams, that it makes sense. So we want to keep growing it, keep doing it weekly, keep having people ask questions, like, subscribe, share it with someone who's interested in getting dental implants. They don't have to live in California. That's the whole goal of Trust Implant Partners, is we want to be able to provide the same techniques, procedures in whatever city you're in.
Quality of material, number of implants, grafting procedures, standardize the protocols, right?
Mm-hmm. Exactly. So that's the entire goal, and we always mention that in all of our live streams.
So. Yeah. And we appreciate the viewers that do watch this. In our minds, we think no one cares about this stuff, but it is important stuff if you have these issues, right? If you're suffering from tooth loss, needing dental implants, this information is actually very, very important for you. We've been doing this a long, long time. We've seen it all, and so I do feel like we have the ability to comment and to discuss, these situations, and to help other doctors as well to avoid getting themselves into situations where they may end up with patients that are unhappy, with trying to standardize or put everybody in this all-on-4 box. So I'm Dr. John Willardson. Thank you all for watching. Thank you, Memo, again, for all of your input. And hit that like and subscribe button, and we will see you next week for Trust Implants live stream. Have a great week.